So welcome everybody to the Cancer Survivors Park Alliance Prevention and Wellness Talk for May. We'll get started in a couple of minutes. Well, welcome again. And tonight we're going to be talking about a topic that I think everybody thinks about, and we really haven't had access to expertise in it until recently, and it's much needed. But tonight's talk is called The Dreaded C Word, talking to children about cancer. And before we get started, just want to give you a few rules of the road. The audience is muted, but that does not mean that we don't want to hear from you. So I will be monitoring the chat feature for any questions. And I think that as you find the speaker goes on, you'll have many questions that come to mind. If you were able to hear this and feel like it would be beneficial to friends or colleagues, it will be a situation where this entire recorded session will be on the Cancer Survivors Park website, and that is Cancer Survivors Park, all one word, .org. So that will be up there probably the beginning of next week. Tonight, we're really pleased to have with us Emily Williams, who is a master's trained certified child life specialist.
You have a good day. You too.
I asked her where she was when I was practicing, because this would have come in very, I would have been very happy to refer a lot of my families to her, but it's fitting a definite need, and it's a resource that we haven't had until recently, and I think it's much needed. So Emily, I'm going to send this over to you, and if you could just kind of go over a little bit of where you grew up and some of your training before you get started on your comments, that'd be great.
Absolutely. Thank you so much for having me. I'm excited to be here and share with y'all tonight. So my name is Emily Williams. I'm a certified child life specialist. I've been practicing with Prisma for the last 5 years. Previously, I worked in the pediatric hematology oncology space as well as the pediatric ICU prior to coming to this unit or this area of the hospital. But I'm from Charlotte, North Carolina originally, got my undergraduate at Appalachian State in health promotion. Then went on to get my master's at Arizona State in family and human development with a specialization in child life. So this work is very important to me because I actually was a child of an adult patient. So my dad had, I'll go to my next slide. My dad had several different types of cancer when I was in elementary, middle, and high school. So I really navigated his journey with a lot of confusion, a lot of misconceptions. And so when I found the field of child life, I knew I wanted to work in pediatrics first to kind of get that base level understanding, but eventually have such a passion to work with children of adult patients with cancer specifically because I was one of them. So as a child life specialist within the CIOS Center for Integrative Oncology and Survivorship, I get the privilege of working with patients and families, navigating a new diagnosis to help them process and walk through what it can look like to have a cancer diagnosis with young children. And what I've learned is that it doesn't stop at the typical nuclear family. So what it looked like the nuclear family before, it doesn't look the same now. So we have a lot of grandchildren that I work with, or nieces or nephews or students in a classroom the support doesn't just end at biological children. So I'm very thankful for the work that I get to do. And I'm excited to share with you guys tonight a little bit about what that looks like. So oftentimes what I hear, the first thing that people say when they're diagnosed with cancer is, what about the kids? A lot of the people who refer me to families and put in consults are like, that was the family's main concern. The American Cancer Society came out with the statistics from 2023 that almost 2 million new diagnoses of cancer were diagnosed in 2023, with 24% of those having young children under the age of 18. So in the US, that would make over 400,000 children that are impacted by a caregiver having cancer. So parents have told me in previous conversations that the scariest thing when they were diagnosed with cancer wasn't the diagnosis itself. It wasn't the treatment plan. It was how they were going to talk to their children about what was happening. Understandably, there's so much emotion that comes to effectively communicating with your children that you have a sickness, that you have cancer. What do I tell the children? How do I tell them? Do I even tell them? Cancer is not unique to the one that's diagnosed. It impacts the entire family unit. So tonight, like I said, we're going to navigate through having these conversations with the children and the teens in your life. And when I say kids, I don't just mean, school-age children, middle schoolers. I mean anywhere from infancy to 18. We'll talk more about what those developmental considerations look like in the next couple slides from here. But I really want everybody to know that even if you're not navigating a cancer diagnosis with a child in your life, a lot of what we're going to be talking about tonight can help you with any difficult topic. It can be anything from a hard thing that's happening at home, if it's divorce, if it's school. A lot of the things that we're talking through are good best practices to have with your children anyways. So I will do my best to refer to the patient as a loved one, because as I mentioned before, it could be a grandparent or an uncle. Sometimes I defer to parents just because that is typically the bread and butter, but I will try my best to refer to the patient diagnosed with cancer as a loved one. These are two common phrases I hear a lot when working with adults navigating the waters of a cancer diagnosis and telling their children. I want to protect them. I don't want to scare them. I want to be strong. The best way to protect your children is to include them in a developmentally appropriate way. What if being strong with them meant modeling your emotions so that then they can learn how to express their own feelings? Children are impacted by cancer and the diagnosis and what's changing around them, whether we decide to include them in it or not. Without a caregiver navigating the conversation, they're left to experience all of this alone. Kids can cope hearing hard things. I think it's easy for us to think, oh, well, they're young. If you think about yourself when you were younger, you probably wanted to be included. And how good did it feel when you were included? It's up to us to offer them the tools and the space and the openness to express and process and ask questions, even when we're afraid of what they might ask. So often how I walk families through how to start these conversations is a who, what, when, where, why scenario. How in the world do we tell the kids? So I'm going to go through all of these different pieces, but I'm probably not going to go in this order. So just bear with me. But we're going to start with who. So who needs to be present for this conversation? Is it all the kids at once? Is it individually? You as a parent or a caregiver are the expert on your child or the children in your life. So you know that you're not going to have the same conversation with a 5-year-old as you are with a 15-year-old. So that would be two separate conversations. You might pair it in a couple of groups of kids. The biggest thing is to make sure you're talking to kids on the same day. It's easy to include the 15, 16, 17-year-old kid on the first day of diagnosis or even just a couple of days following and then say, hey, I'll get to the younger kids eventually. I just don't want to scare them. That's really hard for those older kids. They carry the weight of, oh my goodness, I know this secret. I have this hidden thing that I'm not allowed to talk about or process or feel because my sibling doesn't know. So really it's important to have that same conversation, even though it might be different verbiage within the same 24-hour span. Also, who else needs to be? Oh,
I'm sorry. We talked a little bit about this.
Yeah.
when you make a decision and you get a referral and there's more than one child and there are different age groups and whatnot, how do you make a decision whether to see them as a family unit or individually, or which parents need to be there and that sort of thing?
Absolutely. So I really try and leave that in the hands of the parent. So as I said before, the parents are the experts. I let them really drive the boat on, hey, is your child comfortable meeting one-on-one with me? I'm a person that they've never met before. Obviously, their parent has chatted with me over the phone, but at the same time, my background is in child development. So I try to meet the child on their level and gain that trust and build rapport with them quickly so that they can feel like, oh, this is a trusted person. This is a safe person. So depending on the parent, I have a lot of parents that say, oh, if I have my kids together, they'll fool you. They'll pretend like everything's fine. They'll just laugh the whole time. And so some kids, parents will say, put them together because they'll be nervous, or some parents I'll meet with and bring them all in, but meet with them individually. Sometimes it's with the parent, sometimes it's not. I've noticed that a lot of kids save face when they have the parents with them because they're afraid to ask hard questions. They don't want to ask, is my parent going to die in front of them? They don't want to get emotional because they don't want to think that they're upsetting their parents. So I really kind of leave it up to the parents and provide them as much guidance as I can as they tell me about who their children are, what their development is like, and their ages.
So if they have 3 children, you have the capacity to see each one of them individually?
Absolutely. Mm-hmm. Right. Yes, that's a great question. And then really it's important to have a support person for you as well. So if you are talking about a diagnosis and it's just you and the kids, that can be pretty emotional. And so having a support person there with you, whether it's one of your parents, a neighbor, a friend, a cousin, just having somebody there, even if they don't have to say anything, just to be able to support you throughout the conversation is really important. So there is no perfect time, as you can imagine, to talk to children about a cancer diagnosis. But what I encourage families to do is to talk about it early and often. So most of the time, adults don't want to talk about it or bring it up at all until they have all of the information. And this can be a really long process, as we know that information unfolds throughout treatment, and sometimes things have to take a turn. So including the children early and often takes the pressure off of knowing all of the answers, while the children can feel entrusted that their parent is coming to them and telling them the information that they know. And then when something changes, if something changes, that they can trust that their parent will come back and talk to them about it. Children are observant. They will sense a change. They will feel the stressors if routine is changing. They're very aware, even when we feel like we can hide things really well from them. So talking about it early is really important. And when I say often, I don't mean making the entire conversation, the entire narrative about cancer. That is not my intention at all. Really talking about it early and often helps kids know, okay, there's a time and a place to talk about this. And so I don't have to think about cancer all the time because I know my parents or my caregiver, my loved one is going to talk about it when they need to, while also understanding that if they have a question, they can come to their loved one. So it really is important to set aside separate times to have these conversations, whether it's a weekly conversation or it's, every other week, but letting them know, hey, it's going to get talked about it. So if you don't feel like we're not going to update you on things, you will be in the know. That's really important for children's ongoing coping. And conversation and doses. So I mentioned this before, you're the expert on your child. When you can kind of see kids start to kind of regress, or they're starting to fidget a little bit, avoid eye contact, you can tell when they're at capacity. And kids will take the information, chew on it, and then when they're ready, they'll come back for more information later. So we can trust that if we have an open line of communication, they're going to come back for more information when they're ready. It can be overwhelming to just blurt out all this information and like tell them all of these things because you want to get it out and you want to do it. That can often be a little overwhelming. So I always say less is more. Giving information in doses as you see appropriate for your children is super important. So we've gone over who and when, where. So a neutral space is really important to talk to kids about something serious like a cancer diagnosis. So whether that's the kitchen, the living room, outside, you want them to have a place to retreat to afterwards. So it's really not the best situation to talk to them about it in their room, just because then that's their safe space and they can't retreat anywhere else after that without feeling like, oh, this is kind of my private space. It's important to have comfort items or fidgets appropriately available. So whether it's, a fidget spinner, you want to avoid fidgeting with a phone because you really want the children to be present in the conversation, but just something that they can diverge their eyes from because it is an uncomfortable topic. So whether it's a family pet, you see the dog in this photo, just being able to have a favorite stuffed animal, a blanket, just something to kind of have with you while you're having the conversation. So next is what. We are going to spend some time on this. So this is kind of the meat and potatoes of what we're going to be talking about with the children in our lives. How do we talk about it? So we want to give a warning beforehand, letting the children know, hey, mom or dad or grandma or grandpa, whoever it is, we have something important that we want to share with you. We're going to talk in about 15 minutes in the living room. So this kind of attunes their ears to think, okay, this is something different. This isn't a normal conversation, and it helps them process that it's going to be different information, like I said, than before. Less is more. As I mentioned before, it's so easy to ramble because you're afraid of silence. Practice in the mirror, practice with your spouse beforehand, keeping it as simple as possible so words don't get lost in translation is super important. What I encourage families to do is really just tell their story. So what do they think that their children have observed or seen? So in this picture, you see the little girl or boy, I'm not sure, looking at their mom pouring the coffee on the table, and it just looks like a mess. So they may have observed that mom or dad is super tired or that they haven't been going to the gym. So start there and lead the conversation from there. You may have seen mommy acting more tired, or you haven't seen her going to the gym as much. She hasn't been feeling well. She went to the doctor and they ran a lot of special tests, and they found out that her body's not working correctly, and she has something called breast cancer. What have you ever heard the word cancer? Tell me what you know about it, and then stop talking. It is way easier said than done, of course, but this way you're letting them lead the follow-up of this conversation. And the word cancer is often a lot more scarier for us as adults than it is for kids. Kids are sponges. They've heard the word cancer most likely from an ad, from a friend at school, from YouTube, from somewhere, even overhearing a conversation. It is amazing what misconceptions can come out of conversations when you let them take the lead on a conversation and say, tell me what you know about it. That way, you can debunk those misconceptions and those beliefs and say, well, that's not the type of cancer that mom has, or the doctors think that I'm going to feel this way. And you get to be the person who leads them in the right direction and avoids those misconceptions.
One of the things that we also kind of emphasize to the doctors in training is that a lot of things happen in silence.
Mm-hmm.
And the less is more is the good time. I mean, I think we feel as practitioners that we have to fill up the space. And in this case, the parents feel like they have to fill up the space, and they may not have thought out exactly what they were going to fill up the space with.
Right.
But it's okay for them to have that uncomfortable pause, and
Mm-hmm.
hopefully over time it'll become less uncomfortable.
Absolutely. And I often encourage them to just count to 5 slowly. And that can seem like such a short amount of time, but in reality, it's a long pause. And so that often gives at least some permission for a child to say something, regardless of if they know what cancer is or not. But it can be, silence can be very telling for sure. So the 3 C's, this is something that can be helpful to remember when having a conversation about cancer. So reminding kids that they can't catch it, that they didn't cause it, and then the importance of using the word cancer. So you want to avoid general terms like I'm sick, my belly has a boo-boo, things like that feel a little bit easier to say than the word cancer. Children oftentimes assume sickness is contagious. So we have been in a learned society of COVID and flu and colds and all of the things that we're really stressing our children to wash their hands and to stay away from people who look sick and cover your mouth and do all of these things. So if they don't know that they can't catch it, that it's not contagious, They may think that, oh, I was sick the other week and I must have given this to dad or to grandpa, or I don't want to hug grandma because I don't want to catch the cancer and I don't want to go to treatments and I don't want to lose my hair. And so kids spiral pretty quickly when they don't know if something's not contagious. We want children to be able to differentiate between illnesses and knowing that, hey, cancer is very different from COVID. Cancer is very different from the flu, and this is why. Secondly, reminding kids that they didn't cause it. Magical thinking refers to a cognitive process where children believe that their thoughts or their actions or their wishes can cause their loved one to get cancer. And this is most common between ages 3 to about 7 or 8. And it kind of differentiates between what the magical thinking is. So oftentimes at this younger stage, they don't really know how to differentiate between cause and effect. They don't really understand that, okay, if it's not contagious and we don't know what caused it, they're left with magical thinking. So I was bad the other day and I hit dad, and so I caused him to have cancer. Or for an older kid, it might be, I'm really stressing out my loved one and I can see that I'm really stressing them out and I'm causing a lot of issues at school. And so I caused them to have cancer. Without naming it and saying, hey, you didn't do anything to cause this at all. It might sound silly, but they need that reassurance that there was nothing that they could have done to cause this cancer for their loved one. And the importance of using the word cancer, I cannot stress this enough. Adults typically, like I said before, have more of the negative connotation with this word. Of course, it is a scary and a daunting word. But for children, if we can spell out exactly what's happening with your specific cancer, it doesn't have to be as scary. We can talk about how serious it is, but it doesn't have to have the unknown aspect to it. So many children will hear this word at some point in their life, whether it's on the playground or on TV. But by you as a trusted adult being the one who gets to have it in the first conversation, they trust that you are going to have the most honest definition to what that cancer means to you or to the loved one who's experiencing cancer. It helps their cognitive ability to be able to differentiate between other illnesses. And it just is overall for their entire coping, it's helpful for them to be able to name it and where it's located in the body. So we don't want to say, mom just has cancer. It's helpful to say breast cancer or colon cancer and what cancer is, which I'm going to go into in a second, and how we describe cancer. It helps a lot of misconceptions be put at bay, to use the specific medical word. So this is an explanation that I often give families or talk to kids about when there are situations where parents don't want to be the ones to talk about it. And so I'm the one that shares the news. And this is often how I explain it, especially to school agers. So our bodies are made up of millions, even trillions of cells. Our hair, our fingernails, our skin, everything is made up of cells. They're the building blocks of our body that help them work correctly, that make us healthy. Healthy cells have a very, very important job in the body. They make us jump up and down. They help our lungs breathe, our hearts pump. But when cancer happens, unhealthy cells grow and crowd out the healthy cells. This causes that part of the body to not work the way that it should. And cancer cells do not have a job in the body. We want to stop the cancer cells. It can be that simple. And showing visuals is super helpful for kids too. So showing the difference between what a normal cell is and a cancer cell. And then for a little bit of our younger kiddos, I talk about weeds in a garden. So I'll have kids draw out a picture of a garden. It can have whatever they want in it, whether it's just grass or if it's flowers or fruits and vegetables, if they want to put butterflies in the sky or birds, anything like that. We talk about what healthy gardens need. What do they need? They need water, they need sunlight. And then we also talk about what's unhealthy for gardens, and that's weeds. Weeds crowd out the healthy plants and the flowers. If not treated, weeds can spread. Some weeds spread faster than others, and there are different ways to treat them, like pulling the weeds or spraying the weeds to make the garden healthy again. Weeds are like cancer. We have all of these healthy cells in our body, like the flowers and the fruits and the vegetables. But when cancer happens, like weeds, they crowd out the healthy part of our body, and sometimes it can grow really quickly. Just like weeds need to be treated, we need to treat the cancer in our body. Cancer is treated with things like chemotherapy and radiation and surgery. and to make the body well again. And oftentimes after that, typically I know the treatment plan for that family. And so we talk about what that treatment plan is, whether it's just one of those three things or if it's an accumulation of everything. And we break down what they can expect their loved one to go through. So first, when I explain surgery, it's pretty simple. A lot of kids know about what surgery is from a young age, whether they're getting their tonsils and adenoids out or have a small procedure. But we talk about what they can expect. The doctors are going to give their loved one surgery to get the cancer out. Your loved one will be completely asleep for the procedure, and it's a different type of sleep than you do at home. So they will not feel a thing. They may spend a night or two in the hospital, and they will feel some soreness afterwards from where the surgery was. It's very common. And so letting children know what to expect is super helpful for their ongoing coping. Ways to help their loved one. Kids love a job. They love to feel important. So making a card to send with your loved one to the hospital. And for a teenager, it might be sketching out a picture if they like to do that, writing a note, gentle snuggles when they get home, getting them water. Kids really love to feel like they have a share in their parents' journey for help them feel better. Chemo. So chemo is a special medicine that gets rid of the unhealthy cancer cells, but it also gets rid of the healthy cells too. And this is often when kids kind of attune their ears a little bit of like, well, why does it get rid of the healthy cells? So we talk about how we have cells in our hair, and that's why when their loved one gets chemo, that oftentimes they lose their hair. Some other things that they can expect is their loved one to be tired or weak, having some weight loss, throwing up. It can feel like you're scaring them to tell them all of these things, but it's normalizing it for them so that when they do see it, they don't have to feel as scared because they know, okay, this is common for when people get chemo. That weight loss, throwing up, hair loss, that's all normal. And helping them feel involved again, having a hair shaving party that happens pretty frequently, picking out a wig or a hat, playing quietly next to their loved one while they're in bed resting. All important jobs. And lastly, radiation. So talking about how it's the big machine that's used to zap the area where the cancer is with a big heat ray. And that radiation is done every day for several weeks in a row, but not on the weekends. And children can expect that the zapping doesn't hurt. It doesn't hurt your loved one. The redness kind of looks like sunburn, but it does make your loved one pretty tired. What continued? I told you we would be here for a little while. Kids are egocentric. They need to know what's changing for them, but also what's staying the same for them. They thrive on consistency and routine, and they want to know how their life is going to be affected by a cancer diagnosis. What's changing for them? Are they having a neighbor pick them up from school? If their parent or their grandparent picked them up from school, typically, are they going to take the bus now? And having those expectations in their head early on so they can know what to expect throughout this treatment process and how that can change, but also what stays the same. What stays the same is going to school, playing sports. Rules stay the same. A lot of times parents want to lean back a little bit because they feel guilty or a loved one feels guilty that they have a cancer diagnosis. They want to go a little bit more gentle on the rules and the chores and things like that. It's super important to keep those in place because that helps the child feel like, okay, not my whole world is changing. It's my loved one has cancer and that is very hard and some things are changing, but the bulk of my life is going to stay in a constant routine, which is really important. On this slide, it shows little stickers. It's sometimes helpful for families who are very organized to have a calendar on the fridge or, in the house somewhere where kids can go and pinpoint, okay, grandma has radiation today, or she's got chemo this day. We have a family dinner planned for this night so that they know what to look forward to and what to expect each day. We're going to pivot a little bit into different developmental milestones, common reactions, and how to help. So we'll start with infancy and go through adolescence. So infants, really 0 to 2, obviously they have a very limited understanding of what's happening, but they can sense the changes. They can typically be a little bit reactive and responsive to the stress and to the change in routine. So you can have some increased fussiness. They're aware of their loved one. If their mom was there in the morning, if they typically breastfed and that's not happening anymore, that's a change of routine and that can really throw off a newborn or an infant. And so how to help. Comforting as much physical touch as possible, maintaining as many routines as possible, having a garment of the loved one who is absent and putting that, or rocking them in that, or having that close by as a comfort soothing item is super helpful. For our toddlers and our preschoolers, ages 3 to 5, some common reactions, magical thinking. We touched on that earlier. Repetitive question asking. This is probably the most common, and that can drive people crazy. So really trying to answer their questions is a very helpful thing for them repetitively, paraphrasing, reminding them that you've talked about it, but also answering their questions. It's very common for this age to have separation anxiety, increased temper tantrums, some regression with bedwetting, and fear of contagiousness, like we talked about prior. Informing, if they're in school, informing the school is super important, just as a second and third layer of support if they're starting to act out at school or they're noticing some things that you might notice at home. That's super helpful to have a second set of eyes on them and encouraging them and answering their questions too. Encouraging them to have that emotional expression of an outlet through playing, through having plenty of time with that special loved one-on-one time. And then, like I mentioned before, continuing those rules is really, really important.
So Emily, you mentioned in a couple of these different age groups to inform the teachers in the school.
Yeah.
What does that conversation look like? Is it more just the monitoring and feedback from the teacher to the parent, or is it something where you inform the teacher that there's maybe some things they could do?
Absolutely. I think it can go both ways. So sometimes families, especially in the younger age, they feel most comfortable reaching out. But for a little bit older kids, which I recommend talking to the school, if your child is in school, I recommend the school knowing. And so
Yeah.
sometimes with middle school and high schoolers, parents like, I don't even know who to talk to about this because they have so many teachers. And so I will contact the school often and share with the guidance counselor, or when I talk and meet with kids, I'll say, who's a safe person for you at school? Would you feel comfortable if you told them, or would you like me to tell them? And oftentimes that's just to look out for, like you mentioned, to look out for special things if, people are talking about it at school and they don't want to talk about it at school, just to have a safe person that knows. And so if there's an emotional day, that they can go to that person, or they can just be aware of, okay, their grades might be slipping, or opposite, they might really be trying to perform, which is common in school agers, to gain that just self-worth of, everything feels like it's falling apart at home, so I'm going to really try and be strict and regulated at school. So it's important just to have that open communication line with the school, and not so they would be treated any differently. I think that parents are afraid that if they let the school know sometimes that they'll get special accommodations, and that they don't want that for their children because they don't want them to feel uncomfortable by that. And most of the time I have not seen that that's the case. So what's interesting also for this developmental stage is flipping the question. So if they're asking you why, asking them the question back and saying, how do you think people get cancer? It's interesting to hear the responses. And like I said, that can help with a lot of misconceptions that come up if they are feeling guilty about something that they did or they said. And that way you're able to really meet them where they're at and debunk those misconceptions. So for school agers, I've touched on a lot of these points, so I won't harp on them, but talking to the school, maintaining routine, separation anxiety is pretty common in this age, just because they're starting to gain that resiliency and that confidence in school. And then it's feeling like, okay, well, I need to keep this up. I need to perform. I need to do as much as I can for my part to make mom or dad or grandma or grandpa proud. And so performing and trying to be good is very common, or having belly aches, headaches, feeling kind of sick before school and not really wanting to go is common too. So really in this age, kids are really information seeking. They're wanting to learn. They're mastering a lot of skills and they're reading really well. And so bringing books that are appropriate and vetted that I often recommend, and I have a slide on that later, on what's appropriate to talk to their kids about cancer, to feel like they have some ownership and they really understand. Encouraging them to have fun with their peers, that their world doesn't have to be revolved around cancer, and reminding them also that at this age, some other kids might have had a loved one that has had cancer or had a really poor prognosis from cancer. And so reminding them that, hey, John at school might know a lot about cancer, but he doesn't know about my cancer. I'm going to tell you what's true about my cancer. And so they can trust and know that they have the correct information from their parent. Also offering realistic choices. That's huge. So it's not a choice of if you do your homework, but would you like to do your homework before dinner or after dinner? Would you like to do your homework downstairs with us or in your room? So giving them that autonomy to have choices, but not letting things like homework or chores kind of fall through the cracks. It's okay to feel all the feelings. I don't know if this cut off a little bit at the top, but name it to tame it. So we work a lot within the field of child life, and specifically in my role, to naming what we're feeling. So kids oftentimes just assume everything. They're just mad about everything. They're just sad about everything. And so showing them the faces scale of like, I could feel all of these different ways. They're like, how mad am I, or how sad am I, and what am I going to do to fix this? How am I going to cope with this? So really what I do when I meet with kids is come up with an individualized coping plan. So we can talk about a bunch of different things that help them feel calm or things that make them feel happy. And so when they are feeling sad or tired or confused or worried, they can go to these coping skills and say, okay, this has worked for me in the past, or maybe this hasn't worked, so I want to try something different, whether it's just taking a break, taking some deep breaths, going for a walk, talking to a friend that they really care about, and eating some chocolate. I will do all of those things are appropriate. So just validating that big feelings are okay and they have the permission to feel happy even after a diagnosis is shared. A lot of kids have a lot of guilt about that. And so explaining that all of the emotions are okay. And lastly, for our development, adolescence. So a lot of times we see with our adolescents wanting more independence. They want to confide in their friends, which is totally okay and very normal. They can have some anger, rebellion. They'll hide their feelings. They'll withdraw a little bit, change in performance in school. And so as before, maintaining as much of that routine as you can, letting them confide in their friends, trying not to use punishment in a way of taking them away from their friends, maybe using that in a different way, but allowing them to have that emotional expression and that outlet with their friends is really, really important. Not putting too many additional responsibilities on them. So of course, having chores and doing the normal things that they did before the diagnosis is super important, but that you don't want them to feel punished because of your cancer diagnosis. So it's natural to have a few more responsibilities, like picking up a sibling from school or taking them to practice, but making sure you allow them that time for time with their friends or just time by themselves to really process and debrief kind of what's going on. And letting them know, hey, these are some valued resources. Dr. Google is not going to answer all of your questions, and oftentimes it can bring a lot more harm. I know about my diagnosis, so come to me. And so really, really trying to encourage them to, if they don't feel comfortable talking about it, writing out their questions and giving it to them. It can look a lot of different ways of providing that support. But always want to provide vetted resources, and there's several national organizations that have a lot of great resources for teens. So why? We want to build ongoing trust. This empowers our children to have a sense of belonging and connection, which lends confidence. These skills are setting up children for just the rest of their life, for other hard conversations and times in life. You want to be honest with them. You want to have the appropriate coping skills, the self-expression and regulation. These are all really, really vital things, and it creates trust at the end of the day, and that is invaluable. Some common rebuttals I get is my appearance isn't changing with my treatment plan. Should I still tell them? Absolutely. Children are observant, even when you outwardly are not changing. Children have shared with me that often loved ones, they can have conversations in private, and this is when they really attune their ears. The parents might not think they're good listeners otherwise, but when whispering is going on or doors are being shut, kids really start to attune their ears because they want to know why that they're not included. Secrecy makes things worse. Why not include them early, even if your appearance is not changing? That way, if a plan changes in the future, you can build off of, well, mom was getting this treatment. Doctors have decided to change and go a different direction. And so now I'm going to lose my hair because they decided to start me on a medicine called chemo. And so you're able to build rather than having this whole big conversation 6 months into after a diagnosis. The next one is my child is too anxious. I get this one a lot. This often means the child needs to know sooner because they're already likely thinking the worst case scenario. So providing them information helps alleviate those misconceptions and stressors. What if I don't know the answer? That's okay. I don't know is a good answer, and it's a full answer, in that you will get the answer as soon as you can. You will ask the doctor, you will try and figure it out, or you'll try and do it together. And that creates the bond of, oh, mom doesn't have to know everything, but when she does figure it out, she's going to come back and talk to me about it. And lastly, I have a poor prognosis. This one's a hard one. I will be honest, a lot of families don't want to go here. Of course, they don't want to talk about it. They're mortified if their child asks, "Are you going to die?" It is. There is a way of offering realistic hope while not lying to your child. So maybe saying, it is true that some people with this diagnosis and this cancer die, but the doctors feel really good about the treatment plan, that it will help me live as long as I can. Or the doctors have done everything that they can, but the cancer isn't going away. They think I will die. I will always be your grandpa, and I will always love you so much. Reminding the children that the relationship will never die, and they will always be taken care of. A child will always have their mother, even if she's not here physically with us on earth.
So Emily, I know you know the right answers to this question about telling them or not, but they are referred to you, obviously, because they want advice as to how to communicate to their kids. How do we educate the people that are going to make the referral to you?
Absolutely. So educating the people who would make the referral would really just, getting the information out about child life as much as possible. It's important. I have done several in-services for staff of just talking about why it's important to be open and honest with kids as early as possible, no matter what their age is, because there's an appropriate and a developmentally appropriate way to do it. So I typically get my consults from physicians or nurse navigators, social workers, chaplains, really physician's assistants. It kind of comes from a whole web of people, but I know that the extension of what I can do can go so much further. So really just being able to offer them, letting them know what the service is. I think it's like you mentioned before, it's a newer service, so a lot of people don't know about it, and they refer to counselors, which is so important for ongoing coping, because I am not a counselor, I'm not a licensed counselor, and that is something that I refer out to as well. But being able to refer me early is super important, so that it's not me coming in and trying to pick up broken pieces for a family. It's where we can start fresh and be able to have those open and honest conversations early.
Yeah, sometimes as the referring physician, you don't want another burden to put on them.
Absolutely.
And they probably, it's a big hurdle for them to get over. Yeah. But I certainly see the reason why it's really good to be honest.
Yes.
The kids,
Yes.
they're going to detect it.
Mm-hmm. Absolutely. And there is definitely a sensitivity with timing. As you mentioned, I don't want to overwhelm a person who has just received a diagnosis, because it is overwhelming. They're meeting with so many different people and sometimes wanting to get second opinions. And having lots of conversations, and oftentimes I'm just one additional person. But I have spoken with many families who it's been months into their diagnosis and they found out about child life and they're like, well, where were you at the beginning? And so it is definitely a dance of figuring out what's appropriate and when is appropriate to step in so that I can best support that family.
Right.
Some resources that I often go to are one that's local is Let There Be Mom. So I've sent many a family to Let There Be Mom to promote their legacy, to have special things as they go on through life. And as Kipper has said in the previous webinar, that her goal is for the loved one to be there to give it to them. But if they're not there, that they have something special for graduation or their wedding day. Pickle's organization is an organization that works specifically with kids that have a parent or a loved one with cancer, and it's a virtual support group that's so wonderful. Inheritance of Hope is wonderful as well, and Wonders and Worries. I could talk about all of them for a while,
Right.
but below those resources are the books that I typically send out to families. And we
You
have
faded out a little bit there, Emily.
Oh, sorry, can you hear me?
Yeah, that'd be great.
Okay, perfect. So the books below are also ones that I'll send out to families or refer out to families. There's several others, but those really do a wonderful job of talking about what cancer is and using the word cancer and breaking it down, but having a really beautiful book to entice a child to really grasp what it is, and whether or not they're dealing with a cancer or a cancer that's not resolving, like someone I love can't get better. We have so many resources that we're able to send to families. And I really do feel like a lot of times I'm an extension of the community and getting to help people make connections through vetted resources, which is wonderful. And one resource that I'm very excited to talk about is Climb. So in the fall, I'll be hosting a support group called Climb, Children's Lives Include Moments of Bravery. And it's for ages 6 to 18 to help demystify cancer and address the critical need for children to learn to identify and express their emotions, to aid in the understanding of what their loved one's cancer diagnosis is and have coping skills that will last them a lifetime. It's a six-week program, and it's 6 weeks straight. We'll take a break, and then there's a new program after that. So it'll be continuous throughout the year. And there's more information to come, but we're hoping to get that started in the fall. And we're really excited to bring local support in Greenville in person. So that will be a wonderful asset to our repertoire for sure. And last thing, if you heard nothing, just remember these things. Honesty really is the best policy. When in doubt, keep things normal, allow space for expression. It is so good to have all of these things for any conversation in life. It teaches kids how to identify their feelings and to cope with them. And I would love to answer any questions that anybody has.
Well, I've been monitoring the chat and I haven't seen anything. I think we are very much aligned in the Cancer Survivors Park in that our goal is to empower the patient. I mean, the treatment options that you delineated, surgery and chemotherapy and radiation therapy, it's all very passive. The patient is receiving this, and what we want to try to get across is that they have some things that they can actively do to intervene on their behalf. And I think what we try to do from the standpoint of what you're doing is translating that same empowerment to the children, so that they can, be on the team. I mean, I don't think they want to be left out of the team. They want to be mom or dad or grandpa or grandma's helper.
Absolutely.
And they'd like to be feeling that they're not being left out and sitting on the bench and that sort of thing. So again, as we said at the beginning, I wish that your capabilities, this referral source would have been available for me when I was taking care of patients and their families, because it is an extra stress when they come home and they look different or they feel different.
Right.
I just had a discussion with a young man that's got a wife, and of course he's on his wife's on hormonal therapy, so she doesn't look different. And they have a 6-year-old, and they would rather not have to have her deal with this. And hopefully, via this, I can kind of help them make the decision that she's dealing with it, whether you think so or not.
Absolutely.
Well, this was excellent. We have a lot of professors and everything else on this podcast, webinar, whatever, and I don't think any of them have done as well as you have. So
thank you. I appreciate
very much
that.
appreciate you educating us on this. And I again, this will be recorded. It'll be in the Cancer Survivors Park website library, so you can refer to this and encourage other people to look at it in the future. I just want to advertise next month on June 13th. We'll be looking at a different holistic concept with music therapy, hitting the right notes, and learn about the principles and practice of music therapy. And we have a special guest and a Converse music teacher and music therapist. So we normally like to end this with a quote or a poem. And on this time, we're going to give you both, a quote and a poem. So this is from Vivian Green. And it's quote, "Life is not about waiting for the storm to pass. It's about learning how to dance in the rain." And then a poem from Shel Silverstein, who most people, I think, know. The book that I read to my grandchildren, The Giving Tree, has kind of become almost as well read as Goodnight Moon to young kids anymore. And Shel's a very gifted poet. So this is his poem, and we'll sign off after this. "How many slams in an old screen door depends how loud you shut it. How many slices in a bread depends how thin you cut it. How much good inside a day depends how good you live them. How much love inside a friend depends how much you give them." So we'll sign off again. Thank you, Emily, and you all have a great evening and a great rest of your week. Good
Thanks
night.
so much.